How do you diagnose hearing loss?
The first thing I want to do is I want to take a look in their ears to make sure it's not just wax. Because although it's rare, sometimes the patient's ears are full of wax. We call that otoscopy. After that, we want to assess the status of the middle ear. So we do a test to make sure the eardrum is moving how it should be moving. There's no fluid behind the eardrum that would cause the hearing structure not to work correctly. That's called tympanometry. After that, we move into a sound booth and we do a full assessment of the hearing. Everything from hearing beeping tones to determine what's called thresholds, and that's the level where the patient can just barely hear a certain tone, to speech understanding, because we're not only interested in where the patient can hear the tones, but we want to know what they can understand, because ultimately we're focused on speech understanding. And then through all these tests, basically we put everything together, and that comes with our diagnosis and ultimately our ability to treat that patient and to help them, because bottom line, we want to improve that patient's ability to communicate and improve their quality of life.
Is aging a factor?
You know, as you grow older, there's several things of your senses that can become more diminished. But yes, hearing loss due to older age is called presbycusis, and it definitely can be a factor. There's about 50 million Americans who experience hearing loss, and obviously the prevalence goes up the older that you get.
Can medications cause hearing loss?
Well, definitely certain medications can cause hearing loss. We refer to this as ototoxicity. Okay, certain powerful antibiotics like gentamicin, other things like cancer treatment drugs, chemotherapy agents can cause hearing loss. But a lot of people don't understand something as small as ibuprofen can have a certain level of ototoxicity. Usually when you're talking about hearing loss, you're not just talking about one factor that has caused that hearing loss. It's usually a multitude. Noise exposure combined with older age, combined with some level of ototoxicity. It's a combination effect.
How good is current hearing aid technology?
You know, we're in the digital age of technology right now. Basically, and this can be intimidating for some patients, but you're wearing computers in your ears, okay? The great thing about that, though, is that they automatically make many adjustments. So the patient doesn't have to reach up and, I'm going to a restaurant, so I need to push a button. I'm going to the theater, I need to push another button. Hearing aids these days will sample your listening environment every 6 milliseconds and make automatic changes based upon the environment that you're in. There's some other exciting things with connectivity to the cell phones, the ability to adjust them up and down with the cell phone. We have invisible hearing aids for people who are cosmetically conscious, which there's nothing wrong with, you know. But there's really a hearing device to help every situation, and importantly too, every budget.
What does the future hold?
In your inner ear, you have little hair follicles, okay, that connect to the nerves that send the information to the brain. When those hair cells get damaged, they're gone. They cannot be regenerated. There's research being done at Washington University and other places where they're trying to find a way to regenerate those hair cells. Birds have this ability. There's other animals out there that have this ability, so they're taking a look at that. I think it's not out of the realm of possibility. You know, I definitely think there's some hope on the horizon. But again, the great news right now is we have a really amazing treatment options for the patients who do have trouble with their hearing.
For more information on hearing loss, go to these websites.